Rapid urbanization, migration and increased interconnectivity through a globalized travel and trade have transformed the world into a global village. This globalization has not only brought people together, but also led to spread of infectious diseases posing major global health threats. In order to strengthen world's ability to prevent, detect, and respond to public health emergencies and threats of infectious diseases, a global initiative, the Global Health Security Agenda, was launched on February 13, 2014.
It is preparing the country to fight the global disease problems so that every country should get ready if any outbreak occurs in the neighboring country or by traveling coming to us, they should tackle it.
Recognizing the importance of strengthening global capacity to manage infectious disease threats, India and United States have released several joint statements confirming their shared commitments to global health security as a means of building prosperity for their citizens.
The emergence of a new disease like Ebola, H1N1, antimicrobial resistance and drug resistance TB, these are the different problems we are emerging in the country. In order to tackle this particular problem and issues, we required a global health security agenda. This particular agenda is having the priority in India and globally also.
GHSA is a partnership of more than 50 nations, international organizations and civil societies implementing 11 action packages. The Ministry of Health and Family Welfare is implementing 4 core action packages in India. As a governing mechanism, a core committee under the chairmanship of Secretary Health and Technical Steering Committee under the chairmanship of Directorate General of Health Services has been set up, and a GHSA cell has been created to support both the committees to review technical, administrative and financial matters.
There are 4 action packages that we're focused on in India. One is surveillance. The second is laboratory strengthening, ensuring the laboratories are strong and diagnostic capacities increasing. Workforce development, increasing the public health workforce. And emergency response, detecting and responding to outbreaks.
The Ministry of Health and Family Welfare implementing GHSA 20 projects across 117 sites in 23 states and 4 union territories across India in collaboration with various institutes.
These institutions are very renowned institutions of India like AIIMS, NCDC, NIMHANS. All these are the bigger institutes who are mainly responsible for the health security.
All India Institute of Medical Sciences, Delhi, is working on capacity building for infection prevention control, antimicrobial resistance, lab strengthening, and an external quality assurance scheme intended to provide competent external proficiency testing to all levels of laboratories in India.
The major objectives of the GHSA initiative is to monitor antimicrobial resistance using standard protocols and a common platform nationally so that the data can be shared at the national and international level.
The resistance pattern in the hospital-acquired infections has also come down drastically. And if this initiative is continued and if more and more people are involved, it's going to help a long way in curbing this antibiotic resistance menace in the country.
With the help of the GHS, we are also doing the survey of the antimicrobial resistance in the whole country. So nearly we are doing with the 14 sites from the NCDC, 24 sites by ICMR. We are one of the most important achievement is that we have found out the cause of the febrile illness. It has changed about the treatment regime.
The collaborative efforts of Manipal Center for Virus Research and Manipal University and GHSA has helped the people Tirthahali village in district Shimoga in Karnataka to come out from the clutches of the acute febrile illness or the mystery fever. The university and NIMHANS have set up laboratory-based and case-based surveillance systems in 53 sites across 12 states.
The joint effort by Manipal Center for Virological Research and the District Medical Office for for Health in Wayanad district has resulted in identifying many outbreaks of diseases at a very early stage. It has also helped us to identify the correct causative agents of the outbreaks for the past many years.
These teams, along with NIV and NIE, have identified 7 major pathogens that cause more than 85% of the diagnosable AFI and AES burden in India, including Japanese encephalitis. Lab strengthening is an integral part of the GHSA action packages.
The Laboratory Strengthening Initiative led by NCDC is strengthening laboratories across the entire country. Disease surveillance is increasing. Some of our partners include Manipal University and NIMHANS, NIV, NIE, and many other institutions looking at disease surveillance and emergency response with the Ministry of Health, looking at things, activities such as the Hajj and how we can best protect individuals going on the Hajj, mass gatherings, religious gatherings, how to ensure that the population is protected, how we can detect outbreaks and respond to them in such situations.
Other core areas in which the government is working are emergency response, effective coordination and management of diseases during outbreaks, setting up of special emergency operation centers maintained by the trained multi-sectoral rapid response teams. Workforce development is the final core action package, and under this package, workforce development strategy is a major achievement. This strategy encompasses a localized approach through 3-month frontline training in basic epidemiology skills for district epidemiologists being led by NIHFW, and more advanced 2 to 3 years training in advanced epidemiology through the Indian Epidemic Intelligence Service, EIS.
Our main objective was to strengthen the epidemiologists or the district health managers, and we could see some difference in their attitude, and that result even shown that the number of outbreak detections they could do was almost double the number if we compare from the last year's data.
India EIS was started in 2012 by NCDC and has been a success and is now expanding to multiple hubs at NIE and WHO.
EIS gave me good opportunity to do critical analysis of surveillance data, investigation of outbreaks of common communicable diseases, and respond to the common public health emergencies at time of need.
Rajasthan and Jharkhand, we have already trained the public health people. So we are trying to assess it, that what the impact has fallen down.
Prior to frontline epidemic training, I perceived disease surveillance and outbreak investigations to be tedious and demanding. But now it's exciting like solving a mystery.
Every year, the program is expanding. In comparison to year 2015-2016, this year it is able to respond to 60 major public health outbreaks at 117 project sites, trained more than 25,808 people, and tested 40,225 plus samples for 7 common pathogens.
The way forward of GHSA is to generate scientific data and convert it into government's policy decision.
I hope that this will be definitely more successful in the country, and I wish all the project people to have best of luck for the future projects.
The future is to prevent disease transmission from one country to another country, and definitely it is strengthening the public health system. So public health impact will be seen after some time.
With improved health outcomes and increased access to high-quality services, the Government of India and its partners remain committed to making India and the world a safer and more secure place to live in.